And with this mega bill set to enact the largest cuts to Medicaid in decades, experts are warning that many struggling hospitals in rural communities could close their doors. On Thursday, moments before the Senate passed the bill, Curtis Medical Center in rural Nebraska announced it would be forced to shut down, saying it was in part due to the anticipated changes to Medicaid and cuts in federal funding. Local data shows the next closest urgent care facility that accepts Medicaid is nearly 30 miles away. Joining me now is Tyler Sherman. He's a registered nurse at another rural hospital in Nebraska. Tyler, thank you so much for joining us.
Yeah, thank you for having me.
Absolutely. So were you surprised at the news of this closure? And also, how do you think your hospital and so many other rural healthcare facilities could be impacted by this bill?
I knew rural Nebraska is really struggling just with rural America, struggling for health care and coverage. For us here, uh, we're also going to struggle. We're working with a red deficit with our budget, and we rely on the Medicaid uh, reimbursements to really fix that budget for us. And so it's going to be difficult for us to move forward.
That's so unfortunate. I'm so sorry to hear that. So the bill does have a provision specifically for rural facilities, though. I'm not sure if you've heard, but a $50 billion boost that would be paid out over the next 5 years. Is that enough for the issues that so many rural medical centers face?
Well, in theory, it's a good idea, but it's just a band-aid for the situation. Uh, with Medicaid, people, they're going to be losing their insurance. They're not going to come to the clinic for primary care, which is going to be the cheaper, more beneficial option to fix the conditions prior to it becoming an emergency. They're going to come to the emergency room regardless for much more expensive treatment than with the EMTALA, Emergency Medical Treatment and Active Labor Act. We're not able to refuse those patients who do present to the ER. So that's going to increase our expense. We're not going to get reimbursed as much as we want. So that $50 billion isn't going to be stretched as far as the politicians believe it will be. And likely those charges will be passed along to the private insurance people, and it's going to cost them more out of pocket for medical treatment at rural facilities.
I see. And let's talk about distance. We know that one urgent care facility just closed. The closest facility is about 30 miles away. It's going to take people a lot longer to get to where they need to go when they need that type of medical help. So talk a little bit about that. Why is distance such an important factor here when it comes to accessing health care?
In rural Nebraska, rural America, you're already traveling probably 15 to 20 miles for healthcare, and that distance is only going to get increased with the closures of clinics and hospitals. You're going to have to go to bigger cities that are likely going to be over an hour away. That ER call that you make in the middle of the night, that 5-minute call that you'll come here to a rural clinic, to a rural ER, is going to be 45 to 50 minutes. When you're having a heart attack, having a stroke, those minutes, those seconds, that's the difference between life and death.
Absolutely. Every minute, every second counts. Tyler, thank you so much for your time and for speaking with us about this.
All right. Thank you.